Good evening. How's everybody? Cold. You're Minnesotans. Come on. It's not cold yet. We are very glad that you're here, and there's people that we're live streaming this on Facebook, so there's some people watching from home and sitting in front of their fireplace and feet up. So just think about that. We're super glad you're here in spite of the weather. We being the Fosston Area Healthcare Task Force. It started out as the First Care Task Force back when we were disputing the whole labor and delivery thing. And the city formed this task force to basically to come alongside Essentia to get labor and delivery reestablished in Fosston. We all know pan out, so we kind of shifted gears a little bit. So the task force hasn't been super active, but at this point we said we need to re-engage because of all the changes that have happened in the last 6 months to 12 months here. We really wanted to hold this meeting tonight to help inform ourselves as a task force, but also you, the public, to what is going on, what is the state of primary care in Fosston, or the Fosston area. And that's what this is about tonight, so thank you for coming. Just so you know, some of the task force is here. My name is Bob Overmo. I get the job of being the chairperson of this task force at this point. Other members, Dr. Wes Opsedal, Dr. Charles Wingham, our mayor, James Opperdahl, Roy Dupo, who's kind of cowering in the back, a little shy. You know Roy, he's really shy. We let him go there. Cassie Heidi, the city administrator, Evan Fonder, Mark Finstead, Michelle Lansford, Don Shea Crane, Jim Ockness, Mike Mulry, Tracy Ware, Ruby Sisted, and Kim Spade. There were some other members that originally started but have since decided they're not going to be involved at this point. So that's just a basic introduction. The format for tonight was set up for the two basic providers of primary care in Fosston, being Essentia and now Headwaters Health, to give both equal time, equal opportunity to share what they're doing in primary care today. Because we hear a lot of questions on the street. You guys probably do too. What's being offered? What's happening? My provider is no longer at Essentia, they're at Headwaters or whatever. What does all this mean? Where do I go? What do I do? And the focus of tonight was to provide that information as best we could. Essentia chose not to participate tonight. They were invited to come. I'll be reading a brief statement from them a little bit later. And then Headwaters will have a chance to do a presentation. And then then after that presentation, we will open it up for questions from you guys that are here. Also, people on Facebook will be able to send in their questions. Kirby is monitoring that, and so we'll try and answer whatever we can. If you have a question for Essentia, we're not going to be able to answer that. So, with that, just before we get going, we wanted to, as a task force, express our gratitude and thankfulness for all of the people involved with healthcare in our community. Providers. We are very blessed in this community to have a very strong healthcare system.
Amen.
And we don't take that for granted. And we want to make sure that it's functioning as best it can. So providers, nurses, staff, lab workers, you name it, custodians, whoever you are, if you're working in healthcare, we applaud you. Therapists, we're not getting into all the things, but our dental community, eye care, you name it, we've got it really good here.
Yes.
And we want to keep it that way and see it get even better. Okay? So, we as a task force want to learn along with you guys tonight. So, we're going to let you guys ask questions a little bit later. We might have some questions from members of the task force, but we're going to wait to make sure that you've had your opportunity. So before we get into the presentations, I'm going to call on our illustrious mayor, Mayor Jim. He's going to give us a brief statement on where the dispute and the litigation issues stand.
Thanks, Bob, and thanks everyone for coming in. I want to second Bob's appreciation for all the healthcare workers, not only our new clinic, but all of the healthcare workers that are doing a good job of caring for our citizens in Fosston. I really have just a statement that I'm allowed to read because, as you all know, the city of Fosston, as a party to the affiliation agreement with Essentia, is in litigation. And so I'm just going to give you an update on that, and really that's about all I'll be able to say and comment on. But the city believes it has the right to terminate the 2009 affiliation agreement that brought Essentia to Fosston. Terminating the agreement would end Essentia's affiliation with First Care Medical Services. We've filed an arbitration demand to enforce our right to terminate the agreement. This will be a separate arbitration with new issues that weren't decided in the 2024 arbitration. That previous case was limited only to the issue of OB services. Essentia has taken the position that the city can't terminate the agreement and doesn't have a right to arbitration either. We disagree with Essentia's positions, so the city has filed a motion to compel arbitration in district court. We don't have a timeline for when the court will hold a hearing and decide that motion yet, though we hope it will be soon, and we aren't going to comment on the details of the case or specific legal filings, but we'll reiterate that the city's goal in the arbitration is to restore local governance of healthcare in Fosston to ensure the best possible access to excellent healthcare services for the community and to address many of the issues that we will be discussing today. So, thank you.
Thank you, Mr. Mayor. I do believe that's the shortest comment he's probably
everybody.
Okay.
We're trying.
Jim, you have even on the technology.
Yeah, what did I do?
I don't know, but it fell.
Oops.
All right, I'm going to read a statement that was sent to me from Mike Curtis, the administrator at Essentia Fosston, and I quote, "There is ongoing litigation between Essentia and the city of Fosston, with a hearing scheduled for February 5th. Essentia cannot responsibly engage in a public forum with the party bringing legal action against our organization. Healthcare is under immense pressure, especially in rural communities. We are happy to engage in solution-focused discussions with community partners that will help us all address these challenges and improve care for our patients. However, this is not the appropriate time to do that. Meanwhile, we are proud to continue to provide high-quality, integrated care for the Fosston community. We are glad to support area nonprofit organizations and look forward to breaking ground soon on an emergency department expansion," end quote. So, Jim, if you want to just mention the February 5th
Yeah,
date.
the February 5th has been postponed. It was scheduled to be heard by Judge Rasmussen, and she was appointed to the appellate court by the governor. So the new date we haven't heard the schedule yet.
It has not been reassigned to a Polk County judge. Once it is, it'll get on their court calendar.
Yeah.
Okay, so hopefully soon,
Yeah.
but probably not February 5th.
Yeah.
Okay, all right. So now we get to hear from Cheryl, correct?
Yep.
Okay. Your cohort said, "Call her Cheryl," and I was hoping that you were, they hadn't just sprung that on you.
Yeah, what? Thank you. And I think it's a little bit of a slideshow.
Get close and talk about Cheryl.
Okay.
Boom.
Okay.
So,
Maybe I'll hold. Is it better if
yeah,
I
you
hold
can
it?
hold it if you want.
Okay.
Yep.
I'll start rapping. Okay. Do I have to do anything with this? Like, or just like
Press the space bar probably, or the arrows.
just that? Okay. Okay. Perfect. Okay. I'll take this out and I will do my best to project my voice. So, good evening, everyone. I just want to start off by thanking the Fosston Area Healthcare Task Force, hopefully I got that name right, for hosting this community forum, and just thank you to everyone for braving the cold and showing up to discuss something that really matters deeply to all of us, and that is access to quality primary care close to home. So as many of you know, I'm Dr. Cheryl White. I am one of the 6 founders of our new primary care clinic in Fosston called Headwaters Health. And I'm just really thankful for the opportunity to introduce our clinic and discuss some of the awesome things that we are doing, that we have planned, and just kind of let you know, maybe dispel some of the myths, some of the rumors that are going around town, and kind of just what we're working on towards the future. So, I forgot about the slideshow. Shoot. Okay. Let me get forward here. Okay. So, Headwaters Health, we are a locally owned, independent primary care clinic made up of 2 physicians and 4 advanced practice providers. Collectively, we have more than 75 years of experience caring for patients in this region. So we haven't just worked here, we've built relationships here, we've raised our families here, and we have invested our lives here. And we are here for the long haul. We are not going anywhere. We at Headwaters Health firmly believe that primary care is meant to be delivered face-to-face. There is no substitute for in-person care, for the human touch, the physical exam, the ability to read body language, and the trust that comes from sitting in the same room as your provider. At our clinic, we prioritize real human connection throughout the entirety of our relationship with each patient, from check-in to the time you see your clinician to follow-up and beyond. We proudly offer in-person check-in, not a kiosk. We proudly offer in-person walk-in appointments. And we proudly offer in-person same-day appointments. Not virtual visits, not video only, in person.
Amen.
We believe that this is the only way to truly practice comprehensive primary care. We provide care for patients of all ages, including pediatric patients, adolescent patients, adult care, geriatric care, prenatal, and meeting patients where they're at, which is why we do home visits at assisted livings, as we know that it's very difficult for them to get out and about, or for their families to get them out and about. We also round up the local area nursing homes. We want you all to know that we want to care for your entire family through every stage of life, but we want to get to know you as people, not just as patients. We are also proud to offer a full complement of in-house laboratory services. I know a lot of people probably have questions about this. Initially, we did not have lab, and so it's taken us a little bit to get it set up, but now we are up and running, full lab services. Yes, we say so too. This means faster answers and better care. Some of our labs are send-outs to Ultra Lab, while many tests we do in-house same day, and these include COVID, flu, RSV, strep testing, hemoglobin A1C for diabetes, glucose testing, urinalysis, INRs for people who are on Coumadin, hemoglobin, and vaginitis panels. Having these services on site allows us to make decisions in real time with you during your visit. Again, reinforcing the importance of in-person care. And I will tell you, we have all learned a lot about running a lab, and it is very complicated.
In the least.
I didn't know what aliquot meant, and now I use that word every day.
Thank you for doing the work.
We also offer on-site physical therapy services. This is a relatively new thing for us that started in the new year. Our physical therapists have a combined 50-plus years of experience. Both of them live in this community and are actively involved in multiple local activities, including coaching youth and school sports. Their strong community roots and extensive clinical experience allow them to provide personalized, high-quality care close to home. You can see on the screen a list of the services that they provide, including orthopedic rehabilitation, not just post-surgical, but also for injuries, sports injury evaluation, treatment and prevention, treatment of neck, back, shoulder, hip, and knee pain, strength and balance and functional mobility training, strengthening and conditioning programs, mobility and flexibility improvement, work-related and overuse injury rehabilitation, individualized home exercise plans, education on injury and prevention and long-term wellness, dry needling, pool therapy, which is new and very exciting to offer, return to play services, and vertigo treatment. In addition, we operate a Coumadin clinic. We offer in-person INR testing as well as home INR testing when it's appropriate for patients. And we offer in-person visits with our local RN, who most of you may know, but she really wants to get to know you and get to help you out with your care. One of the things that really sets us apart is that we live here in this community. Our kids go to school together. We see you all at the grocery store. You are our neighbors, our business owners, and our friends. And many of you in this room can probably attest to the fact that we answer calls, texts, Facebook messages, you name it, at all hours of the day and night. That level of access to and accountability comes from being invested in this community and not commuting into it. And this is something you get from providers who live here, who have a long-term stake in this community. One of our top priorities currently is ensuring that we are able to provide care for our patients on an inpatient basis. Let me see if there's another slide here. I can't remember if there's... Oh, no. Okay, sorry. Until our departure, the 6 of us had privileges at Essentia Health. At the Fosston Hospital, like many hospitals, providers do not need to work for the hospital to have clinical privileges for admitting and seeing patients in a hospital. Prior to our departure, Essentia confirmed with us that we would maintain our privileges after leaving our jobs at Essentia. Unfortunately, on our final day of employment, despite there being no clinical care concerns or disciplinary actions involving any of the 6 of us, we were informed that we would no longer have privileges to admit or treat patients at the Fosston Hospital. We're hopeful that through ongoing discussions with legal counsel, this matter can be resolved, and that we will once again be able to provide inpatient services in Fosston. In the meantime, we are in the process of obtaining hospital privileges at Sanford and Bagley, and we'll have more to come on this. We are excited for some things we have in our future, things that we're looking into. We are exploring the addition of X-ray and other imaging services. We are planning a clinic expansion as we have already outgrown our current space. Thank you to the community. We're also looking to expand access into surrounding towns, so more to come on that. We are incredibly grateful for all of your patience and your grace as we grow, and we're deeply thankful for your support that has made this growth possible. We knew our space was going to be small, and I think it got a lot smaller a lot faster than any of us anticipated. So thank you all for that. There's a lot of rumors that have been going around town, a lot of myths, and thankfully a lot of people have come to us and said, I've heard this, I've heard this, I've heard this. Please, enlighten me, tell me the truth. And we really appreciate that. And I do want to encourage, if anybody has any questions, if anybody hears anything, and you're like, oh, is that true? That doesn't sound right. Please just come and ask us. We will tell you. We will set the record straight. But we do want to take the opportunity to kind of address some of the most common things that we've heard from people in the community. Number 1, Headwaters Health does not take insurance. This is almost laughable to me. I'm not sure if you can ever have a healthcare facility that doesn't take insurance. So we do take insurance. We accept insurance. We accept all insurances except for Humana. We will not be billing an insurance company if we didn't have it. If we didn't have your insurance, we would tell you, we don't have your insurance, we won't bill it. Contracting insurance with insurance companies is very complicated. It takes a very long time. But until we have those contracts in place, we would not bill your insurance. So that is a myth. Myth number 2, which sadly, unfortunately, we've heard from a lot of patients. You will lose your benefits if you switch to Headwaters Health. Your benefits are provided through county services. They do not depend on where you receive primary care. Choosing Headwaters Health does not affect your eligibility for your benefits. Myth number 3, you will not be able to continue your controlled substance contracts if you obtain care at Headwaters Health. This is also false. We are fully licensed and able to prescribe medications when medically appropriate, whether it's a controlled substance or not. Myth number 4, Dr. Swanson is retired. Easy, Paula. He can't retire until I say he can retire.
A little older than he is. My feet are gypsies.
Oh my goodness, yes. So we have had patients crying. We have had patients very concerned because they have been told that Dr. Swanson has retired. Clearly, this very dedicated man is not retired. Dr. Swanson's given so much of his life to this community, and we thank him for his continued dedication in our mission. So.
Amen to that.
So now I know a lot of you might be asking the question, why? Why did we do this? Why would 6 providers leave jobs that they loved after more than 75 combined years of experience? The answer is very simple. We did it for you. We did it for all of you.
Thank you.
We did it for this community, and we did it to protect rural health care in Minnesota. We did it because patient care and patient safety has to come before corporate directives.
Amen.
We had to make a choice, and we chose patients. It became very apparent that our goals were incompatible with the direction we were being forced to take. The vision that we had for patient care, for our community, and for the future of rural medicine did not align. Decisions were made far away from here by people who don't live here and don't know this community, and people who did not share the values of this community. And today, that's no longer our reality. We look to our future, and we do so with clarity because we have seen what happens when we have no hope. Now we have control. We have control over our essential services, how we allocate our resources, and most importantly, how we care for this community. I want you guys to imagine with me. Imagine a hospital where the administrator lives locally and is personally invested in this community. I want you to imagine a hospital where a physician leader comes from a local physician who understands the needs of their neighbors. I want you to imagine a hospital where joint replacements are a routine thing and not sent to a different facility. I want you to imagine a hospital where your doctor rounds on you every day, listens to your heart and lungs with their own stethoscope, and knows you, your family, and your needs. I want you to imagine a hospital that embraces OB patients instead of refusing ambulances with OB patients in them, where we proudly and safely care for mothers and babies. And I want you to imagine a hospital where we will deliver babies again.
Amen.
celebrated instead of scrutinized. A hospital where a hospital that has a culture where employees are supported. I want you to imagine a hospital where every patient and family has access to a social worker who is invested in their care, no matter who their primary care provider is. I want you to imagine a hospital where general surgeries are a daily occurrence. Imagine you don't have to be shipped hours away to have your appendix out, or your gallbladder removed, or your hernia repaired. I want you to imagine a clinic where you are checked in by a real person who knows your name. I want you to imagine a clinic where labs are done in-house so you don't have to make multiple trips in -50 before your appointment. I want you to imagine an emergency room where you have privacy, where you don't learn about your neighbor's diagnoses through a curtain. I want you to imagine an emergency room where your dislocated joint can be reduced without transferring you. Where if you arrive in respiratory distress, a trained anesthesia provider would be available to care for you. I want you to imagine a facility where care is provided by local providers, people who live here, people who raise their families here, and people who are invested in this community because it is their home. I want you to imagine all of this, and I want you to imagine more. We do. We do imagine this. And we know that all of this stuff cannot happen overnight, but this is our dream. This is our vision for the future of healthcare in this community. And all of this is possible. This isn't just hope. This is possible. This is our intention, and this is our future. In closing, we just wanted to also make it clear that the opening of Headwaters Health was not a result of the ongoing dispute between the City of Fosston and Essentia Health. While some of the values behind our decision, such as ensuring care and resources remain local, may overlap with the themes you're hearing in that discussion, the dispute itself played no part in our decision to open Headwaters Health. Our clinic exists solely to serve this community and to meet the healthcare needs of this community. We want to thank the community from the bottom of our hearts for your trust, your encouragement, your prayers, and your support. When our building was under construction and we were in a fish house behind the building, we got baking delivered to our door. We got dilly bars delivered to our door. We got people knocking on the door saying, "I'm here to pray for you." It meant the world to us, and it meant we were doing the right thing. And no matter where you choose to receive your care, we hope you feel heard, respected, and truly cared for, because that's what healthcare should be. We are honored to serve this community, Fosston, and the surrounding communities, and we look forward to continuing this journey together. I do want to share a verse that has inspired us in our journey. For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you, and plans to give you hope and a future. So thank you, and we're happy to answer any questions.
Thank you, Cheryl. And the rest of you for taking that step. it means a lot. It means a lot to this community. I know it was not
I mean, unless you've picked a specific insurance plan that is only for, a certain organization. In our area, I think, I would say the insurance, you can go wherever you would like to go. So, other than if you're employed, obviously, by an organization, so.
Great, thank you.
Okay, so a question from Facebook Live. Should we, as patients of Headwaters Health, write letters to Essentia Health requesting that our health providers have clinical privileges admitting patients, etc., to the hospital in Fosston?
I think that you should do whatever you feel compelled to do.
Boy, you're a quiet crowd.
Cheryl just did such a good job covering.
Well,
Is that the only question on Facebook?
Yeah, we got it off.
There's 133 watching.
Wow.
okay.
Wow,
That's great.
that's good.
Oh, we got another brave soul.
I'm not a brave soul. Where's your mic?
Over there.
Oh. I guess my question has to do with an emergency. Someone is really choking. Something happens now. We don't have a choice, do we? Other than to go locally, correct? To a hospital?
Yes, if you're having,
Huh?
yes, if you are having an emergency, you need to go to the closest emergency room. So that would be here, and if you live in Fosston, that would be the hospital in Fosston. And you will be cared for by an excellent team that will take great care of you.
So then a follow-up, do we have an option to go to you guys?
Absolutely. As a hospital follow-up, as an emergency room follow-up, you can follow up with whoever you would like to see.
Okay, thank you.
I don't know any of the rules with EMT. I'm not sure, is there a plan for there to be an alternative EMT response team or members of a team that would give us another option locally for emergency care, long term?
So, that's a good question. So not from our standpoint, from where we are, at this point, we have no control over emergency medical services. So that would be a question that we can't really answer as far as direction for EMTs or emergency medical care. So, unfortunately, I can't answer that question, but it is a good question.
also, I think that we know that Essentia operates the current ambulance service, and so if you're asking, is there an alternative plan, I don't know that one's planned, but I do know that there's been discussion of what would probably amount to paramedics. Our fire department, I think at our last annual meeting, maybe brought up the potential for that, and it probably will get discussed some more, but that would be an alternative way to provide, you know, initial emergency care, but other than that, Essentia, as I understand it, there's a territory where they get the first call from 911, and you probably know about that, but so.
Okay, we have another question off Facebook. What effort has Essentia done to collaborate with Headwaters? I just read them.
So don't shoot the messenger.
I guess to answer that question, I would respectfully say we would be open to a collaborative relationship if one would exist. So.
Okay, let's say I have a farmer emergency, right? So I fell down, broke my foot, I'm still putting my fence post in, I'm gonna come to you 2 days later. Are you gonna be able to help me with my broken foot? Like, can you take my picture, put me in a cast, see me for my follow-up care?
Yeah, so we could definitely take care of you. We would send you for an x-ray. We can review that x-ray. We can put a cast on. We can see you for your follow-up care, yes.
And where do you send it to get the x-ray?
So typically Essentia
Okay.
at this point, yeah.
Okay.
We have looked into getting an x-ray machine, but apparently it's a lot more complicated than just throwing an x-ray machine in a room. You know, they need like lead balls and all that stuff, so yeah. So we are looking into that though.
It's nice to see everyone here this evening. I have a question for the city and the task force. And I have a question and just some history, if someone can remind me how long we've been a community that has had a hospital and a community clinic. To my knowledge, it dates back to the Sathers.
Earlier than that. 1947, the city acquired the old hospital building downtown.
Right. So the history that I'm aware of is when Essentia came in the picture was when all facilities were looking for the electronic medical record. And the electronic medical record is important because all of us go on it with my chart. And to get an electronic medical record, that costs a lot of money. They were, for those of us who were first here at the time, there was a big spiel and we were told that they were there to help us with services, to be part of our group, and to make healthcare for our communities better. And as Jim is saying, since in the 1940s, we have had community healthcare, a community hospital. And how it's gotten to this point when actively you've got the task force, you've got medical people in here who have tried to communicate. It was to be a partnership, not a takeover. So I applaud everyone in this room for coming to the meeting. I applaud the healthcare workers that really made a big change so all of us could have a choice in healthcare. And I just really like to see people making an active movement. So if anyone else has comments, don't ever be afraid to say them. Because without people like all of you, we wouldn't even be where we're at today.
She triggered me. I wanted to know, how do we get our medical records transferred over?
Yep, so our electronic medical record, just like at Essentia, just like at Sanford, is Epic. All of those electronic medical records speak to each other through something called Care Everywhere. Once you have a visit, once we have your chart established, we can pull all of those records electronically through Care Everywhere, so we can see your labs, your imaging, your visits, and your, this person put you on this medication, problem lists updated, that sort of thing. So, so once we have that chart, we can pull all that in, and vice versa. They can see things from our electronic medical record, Sanford's, Altru's, everybody. So the electronic medical record makes it really, really handy for collaboration of care, honestly, and so things don't fall through the cracks, so we can know what your specialist said, what happened when we sent you there. So very handy.
So that is established on our first visit?
Correct.
Okay, so is there any way to get that established before our first visit?
So unfortunately, you need the visit to be able to get approval that I can access your Care Everywhere. Okay. Yeah.
Okay.
Yeah.
I'm really bad behind the microphone. I just wanted to say that I think it's really cool what the task force is doing, and I'm just really looking forward to the day when OB services can be back in Fosston. I'm a primary provider for home birth, and there's not really much that's worse than being in an ambulance with a mom who's on her way to the ER and being told we can't go there. So I just wanted to add that tidbit and say, keep working and doing a good job and bringing OB care back to Fosston.
Yes.
I have 3 more, but one of them was already answered. The top one was already answered.
Okay. Question, where are the day-to-day operational costs coming from?
Easy questions here today.
Well, right now they're coming from the bank and our pockets, to be honest. So, yeah. So we had to take out a loan to open our business, and we had to put in a large chunk of our own money to get this business up and running. So that's what's keeping us going right now. So.
we as residents of Fosston do to support the staff at Headwaters going forward? And in parentheses, it says, I know there have been discussions with ISD 601 about offered student health services and a continued exploration into what possibilities could further support our students.
So thank you for that question. I think to answer the first part of the question, what can you do to support our staff? Just please keep doing what you're doing. Keep praying for us. Keep coming to visit us. Just keep encouraging us. We appreciate that more than you will ever know, more than we could ever say. As far as the second part of that question, the school district, so full transparency, we did approach the school division about doing in-person visits in the schools. So sick visits, mom and dad can't go get their kid to bring them to the clinic, mom and dad are at work, we can't take a day off work to do this. Does my kid actually need to go home, or can they stay at school? What is this rash? Is it contagious? So we had a couple of meetings trying to sort that out. Unfortunately, the school has a contract, an athletic contract with Essentia, and there was some concern that partnering with us in that regard to offer that service may in turn jeopardize that contract and their relationship with Essentia.
What happens to our local people that work for Essentia?
Our local people that work for Essentia are amazing. I just want to say that. They're amazing. They do amazing work every day. When we talk about the collaboration question, we collaborate with them. We call them. We say, we're sending you this person. We're sending you this referral. I don't know what this question is in regards to. It just, what happens to the local people that work for Essentia, if what, I'm not sure. We want the staff, we want you guys to know the staff are amazing. We want them to keep doing what they're doing, and the amazing work that they're doing taking care of people.
Sit down, I have a question. How does it feel to be your own boss?
These guys are the boss of me. I'm not the boss.
I'm asking also.
Those guys are the boss of me. I think, obviously, it's stressful. It gives us lots of anxiety and a lot more gray hair. I think we're up at night for different reasons now. Before it was stress about our job, and now it's stress about our business. But it's also very freeing. It's also nice to know that we are in charge of what happens with care, that we make decisions that are in the best interest of our patients, that we have control over that. And instead of being told, we have a collaborative group to decide what's the best route to go. So it's also very freeing.
Amen.
Could have ran that to you, Sharon.
Thank you. On my chart, I don't have Headwaters.
Yeah.
So how do I have to call you?
Yeah, so that is a great question. So our MyChart is, so the MyChart app will be the same, whether you come to Headwaters, whether you go to Essentia, whether you go to Sanford. The app on your phone is the same, and then you toggle between the organizations. We can be found under Altru and Grand Forks. So if you go into your MyChart, you search for Altru, you have that choice. Pardon? And the reason for needing to search for us under Altru and Grand Forks is because that is who we get our electronic medical record from. As Carrie pointed out, electronic medical records are very expensive. And so most smaller organizations or private practices will pay a yearly and monthly fee to tap into bigger organizations' electronic medical record. And so fortunately we have been able to partner with Altru to allow us access to the electronic medical records. So if you need help with that, if anybody needs help with that, please call. We can certainly send a link to you to get set up with that MyChart. We can text it to you, Sharon, and then you just click on it and type in your information and it should open right up. So, okay, but yeah, so if you're looking for it, it's under Altru and Grand Forks.
If anybody's ever been to Riverview in Crookston, it's kind of that same story. Riverview is under Sanford. It's kind of the same idea.
Sure. Yeah.
Could Vicki or Jacob give an update on therapy services? Heard something about pool. I don't know if that's 8 ball or
Pool, yeah. Billiards. This was not on my bingo card per se. Okay, so in December, we were able to, Headwaters Health was able to get a contract with the city of Fosston to utilize the Civic Center pool for aquatic therapy. It is a service that then began in January. We have not done a visit yet, kind of getting our feet underneath us, Vicki and I, and arm wrestling over who has to go in the water. I'm probably going to lose. But hopefully within the next week or two, we'll have more out on that. Our goal would be to have an hour or two a week to start with to get patients in the water, whether that's for pediatric patients or people with joint pain, back pain. There's a lot of good stuff out there that getting in the water helps with. So definitely a service that we're excited to offer. It's been something that I've wanted to see in Fosston for at least 10 years. We had a few roadblocks along the way, but now we're in the clear and ready to get it going.
Can you explain what needling is?
Yeah. Okay, so
Investments in sliced bread.
so dry needling, you can.
Can you repeat the question?
Oh, sorry. The question was to explain dry needling. Dry needling, I explain it. It's like the Western medicine version of acupuncture. If you've ever had acupuncture, it's the same needles that we use. So it's a thin monofilament needle, just basically meaning we're not injecting anything. The needles are inserted into the area where you're having discomfort, whether that's muscles, tendons, ligaments, and then for most patients, and if you're coming in for a trigger point, we would just put the needles into your muscle, so a knot in your muscle, that would be a trigger point. If you're coming in for any other sort of joint pain, those needles are then hooked up to an electric current, and then that treatment runs for about 20 minutes. Had a lot of success with treating pain that other forms of therapy just haven't been able to touch. I've been doing dry needling for a little over 8 years at this point, and had just an absolute ton of success with that.
And I have one more question.
Okay. I feel like we're getting out of this.
If we have a pain, like how soon can we get in to see you? We make an appointment with like Dr. White or Swanson, right? And then they send us to you?
Correct. So, so in the state of Minnesota, we do have access to direct access for physical therapy. We work very closely with your primary care provider. If
If you have Medicare insurance, we do have to have you see your provider face-to-face first. Other patients, we do also like to have you see your provider just so that they're involved in your care. But it would be a visit with your provider. They would refer you to therapy, and most days there's an opening with either Vicky or I. So we could see you likely that same day.
So I have one more question. So like we have an initial issue, and then we go to Dr. Swanson or Dr. White, and then do we have to continually go through them, or will we be able to talk to you directly then?
So the question is, after your initial visit with the primary care, how does follow-up with physical therapy go? So we would establish a plan of care with you, and then you would be just working with us. We would be contacting your primary care provider if we had any updates for them or questions for them. We would obviously refer you back to them if there was a need for that. But your day-to-day care then, through that episode, would just be with therapy.
Oh, that's nice. I like that.
And I should say the other thing about dry needling, it's a retail service, so it is not covered by insurance. There are a couple insurance companies that have had success with, but for the vast majority, it's just out of pocket. It's a $40 treatment, and you do not need a physician referral for that, given that it is not covered by insurance. So you can just come directly in and see me for that.
Okay, thank you.
They better run away.
Oh, yeah. Needles and electricity. Sounds exciting. Okay, there is a request for all of the providers to come up and introduce themselves.
Yes.
Woo! Come on, finally. Come on, dog, get up here.
Yeah. Dog.
Hello, I'm Maya DuPong. I'm a nurse practitioner here. I grew up in Fosston and then left for a period of time and then moved back after I was done. I primarily do a lot of probably more younger population. Not that I don't have my my chronic older patients that I don't enjoy too, but I would say I do a lot of OB care along with Dr. White, and then that brings in newborns and children as well. We obviously like to have a wide variety of patients covered with healthcare, so we all kind of have our niches of what we do, but we also all do it all. So, oh, I'm sorry. I have been here for 16 years as a nurse practitioner. Prior to that, I worked for 10 years in Boise, Idaho as a labor and delivery nurse, and that's why I ended up taking on a lot of the OB stuff.
And I take care of the northern region. I don't live in Fosston, but I travel between here and Goodrich, or halfway between Goodrich and Grigla every day. I have worked here in the Fosston area. If you count my time as an ER nurse, it'll be almost 20 years. I have been a PA for 17 years. I worked in Staples at Lakewood Health before coming to Fosston, and when I got my job in Fosston, I knew this was my home. So I anticipated retiring here, and now that we have Headwaters Health, I will retire here.
Just a lot later.
Just a lot later, yeah. I'm not at 55. I'm 75.
With a helicopter, hopefully.
Yes. My son wants me to purchase him a luxury helicopter. I have no idea why. But for me, I do a little bit of everything. I have kind of pigeonholed myself into orthopedics, so I'm okay with that. I do a lot of internal medicine. I can do follow-ups for pretty much any surgery you have, because I probably have the specialist number on my speed dial. They should have thought twice before giving me their cell phone numbers. So, I will work really hard to find out all sorts of weird things, and that just seems to be where I ended up. Not where I started, but that's just where I ended up, and I'm okay with that. So, there you go.
Hi everyone, I am Sheila Dyken. I'm a nurse practitioner. I'm probably the newbie in the bunch of us 6. I started my career in construction, so I did that, and then I went back to school and became a nurse. Really, I started at the assisted living as a CNA and worked my way up. So in this role, I started about 2022, I think. Gosh, yeah, that sounds about right. So started the newbie in the bunch. My mostly specialty, I do a lot of substance use disorder. So I help people kind of rehab from abusing drugs and things like that. That's really a passion that I have. I really enjoy these types of visits, and they're probably have grown to be my favorite. But I see a lot of little people, big people, old people, young people, and pretty much anybody who walks in, you might get to see me if everybody else is full. So I'm the friendly face if everybody's busy. So come and see me when you get sick, and we'll take care of you.
Well, I'm not good at this public speaking stuff, so
But you are time.
I'm Ryan Johnson, from Erskine. I live in McIntosh right now. Been here for 90% of my entire life. Thought I was going to move out one day and never come back to this community, but for some reason, it always draws me back here. So I'm just want to thank everybody again for coming out. There's a lot of people in this community that are big influences on what we did here and helped us through this, especially our nursing staff here. And thank you, Peggy, for coming with us and helping us out here too. But started my career as a paramedic. I worked in Grand Forks and Fargo for a while there, and then I started up the Bemidji flight team for Sanford and worked for that for a couple of years. I'm a PA. I went to UND. Been doing it for about 8 years. All right. Also a beaver. Okay. I don't describe it. Yeah, anyways. So, what I primarily see is a little bit of everything, actually. I did a little bit of wound care before I left Ascension, so I really like wounds. Otherwise, young, old, internal medicine, you got it. So, I got to thank everybody for coming out and listening to us, and appreciate you. Thank you for the support.
Thanks everybody for coming. I guess I'm the old guy. Been here for a long time, and I think everybody probably knows me. I started back as a student back in 1989. I was here for about a year. Went away single, came back with a family. So we raised three little ones here in our community, and now we're bringing up a couple grandkids. So I kind of do pretty much everything as well. I started out doing a lot of obstetrics, and of course that stopped 5 years ago or however long it's been. But we hope to get that going again, and we want to be committed to our community needs and stay healthy with you guys. So.
You used a roller skate to work, didn't you?
I suppose a little bit of that. What's that?
When did that happen?
Oh, when I got my new hips. But yeah, we appreciate all the support we're getting over at the clinic. We love you guys. Keep coming. And call us a lot, okay?
We love you too.
One more question at this point, Facebook. How long do they have to submit a bill? Haven't heard of a patient receiving one yet.
Great question. As I previously stated, until we are contracted with your insurance, we will not submit a bill. again, that process is very time consuming, a little bit of a hassle, a lot longer than we like sometimes, but, so if you have not or are expecting a bill and have not seen one, you may not see one, yeah, I think we shortly, so there's some insurance companies that we do currently have that we can bill, so hopefully those you'll start seeing coming out, and we'll see from there. But again, just reassurance that if we're not contracted by your insurance company, you won't receive a bill likely. So. Just if I could, I know we've kind of done a lot of talking, Jacob and Vicky got put on the spot. I don't know if Andrea and Mallory, do you guys want to come up and talk from Pine Peak Therapy? And I know you guys are getting a new service, and if you wanted to share too, I think that would be appropriate.
Sure. Hi guys, I'm Andrea Wilson. I'm one of the owners of Pine Peak Therapy here in town. We have moved, so we're attached to the fitness center now. So if you haven't seen where we're at, it's a nice big building, great parking. So I'll just keep it short and sweet. I am one of the therapists as well. I am an audiologist, but I'm also a speech therapist. So I do that for both adults and for children. So audiology is the hearing aids, ear cleanings, all of that fun stuff. We do have occupational therapy as well. We have physical therapy. We have pelvic floor therapy. So Mallory does that for men, women, and children. And then we are really blessed. We have one of the only certified hand therapists in northwestern Minnesota. So we're really blessed to have Ashley with us. Just let us know if you have any questions or you know where to find us. It's the big building, just north of the clinic there. So thanks, guys.
More questions? Kirby, are we flat out on Facebook? No more?
I don't see any more.
Okay. Going once. We don't want to keep you away from enjoying the rest of your evening, you know, cross-country skiing home.
Roller skating.
Roller skating, yeah. Other task force members, anything you guys want to add at this point? Otherwise, we're going to call it a night. And again, our thanks to all of you, not only those of you that braved the cold, but those on Facebook, listening. You know, if you think of a question beyond later, as these guys have said, call, stop in, and get your question answered rather than to assume or, you know, kind of wonder. Get it answered. So, all right. With that,